Those of you that are wondering what I do with my skin, exactly what kind of treatment, I get to come to Love Beautiful Skin maybe once every couple of months, and I'm gonna have her explain everything and what she's doing, why she's doing it, what it's for, what DMK stands for. I'm gonna go ahead and set up. I'm gonna change, lay down over here. I'm gonna set the phone up on that little light ring, and I'll be back. All right, guys, this is Autumn.
Hi.
She's gonna explain everything as she does, benefits are, and why she's doing it. What am I getting done today?
So we're going to start off just by double cleansing, and then we're going to do the derma first. The dermaplaning is a mechanical exfoliant. It's done with a scalpel blade. It doesn't hurt at all though. It removes the first layer of the skin, so all the dead dry skin and then all the fine vellus hair on the skin. We do it at the beginning of the facial just because all of the products are able to penetrate deeper into the skin. Then it also gives you just like a more flawless overall look, especially when you put your makeup on. It just goes on more smoothly. And then after we do the dermaplaning, we're just going to exfoliate with the hydrating, gentle exfoliation, the Vital C, and then we'll go into the Rezenerate. So it's just going to take probably about 5 to 8 minutes to dermaplane, and then we'll go into the next step.
So what exactly does DMK stand for, and what are the benefits? What does it do? Why do people get it done?
DMK is just named after Dene. He's the owner of the company. Someone would get DMK if they really wanted to undergo like a skin revision process. So someone, I mean, it is great if you just want like, you know, a hydrating, you know, tighten up the skin facial, but most of our clients that get DMK come in on a regular basis. So it treats pigmentation, anti-aging, severe acne. We can treat all different skin with the DMK, and we can do it all at once. So like today we're going to be doing the muscle banding on her. The muscle banding is what helps tighten and tone the skin. It's a muscle contractor, and it helps strengthen the skin. DMK also sets other treatments apart because we're treating the décolleté, the neck, and the face.
Right.
And a lot of times in facial, we just treat the face. So we're really tightening, lifting up the skin, like not only in the neck area, but in through here, and through here in the eye area. Enzyme 1 is really the oxygen therapy it gets. It helps remove the cell buildup and just gets your skin really functioning how it should be. Whereas if you're doing the muscle banding, the enzyme 2, you have to have at least 5 enzyme 1 treatments done just so we can get your skin functioning how it should be, because as we age, you know, everything just slows down and is not working, you know, functioning correctly. You can feel the mask tighten, and you can feel kind of like a heartbeat in the skin.
See, I did like 5 treatments, and then I started doing the muscle banding, and I could tell a big difference once I started getting that done as well. And then I also have these like little mini capillaries in my face that we've been treating as well, so it's helped with that.
Yeah, and there again, you know, that's more of an advanced thing. So after we build up the skin and strengthen it, we are able to treat things like broken capillaries. So the first several treatments, we're just trying to like strengthen your skin, and we're constantly challenging it with different exfoliations and treatments, but we don't want to do something that's going to be too much on the skin too soon. So that's why we start off with more mild exfoliations and just really, you know, trying to get the skin functioning how it should be before going into something that's too intense for the skin. So this is just the Vital C Hydrating Enzyme Mask. It's a gentle exfoliation. It's papaya fruit and pineapple fruit extract. Now it's normal for it to be tingly and warming to the skin, even more so after dermaplaning. The dermaplaning, since it's removing that first layer of the skin, it's, you know, you're going to feel the sensation a little bit more. And next we're going to be doing the Rezenerate, which the Rezenerate you can actually get done as a completely, you know, a facial on its own too. She's just getting the whole shabam today. Rezenerate you can add on to any facial. What it does, it kind of acts similar like microneedling, just without the downtime, and it doesn't actually like puncture the skin. It has a bunch of tiny channels that press the serums and whatever. We mix up a different concoction for each person. Today, I'm probably just gonna be doing some very like hydrating serum, strengthening, and probably putting a little bit of kojic to help with some pigmentation. So the mixture that we use is gonna be different for each client, but what it does is, we always use the example, if you have a balloon and you put the serums on the balloon and then put the Rezenerate over the balloon, the balloon will not pop, but you'll see the serums like start to drip within the balloon, and that's what it does to the skin. It doesn't, puncture the skin and make it bleed, but the serums start to, push down within.
So it's actually, what did you say, it would be better for the skin than microneedling?
It's just a lot more gentle. So if someone doesn't want the downtime and has, maybe more sensitive skin, then I would definitely say it would be a good option, because it can help, with pigmentation, anti-aging, with acne scarring. It can help with all that.
That'll be the first time that I'm getting that. Yeah. It's kind of an add-on for the DMK that I'm doing.
And too, if you've never had a facial done before and don't really know what you need, you could either schedule a consultation or even just like a mini facial, just so we can take a look at your skin and we can recommend what treatments. With the muscle banding, you can't do any massage afterwards.
Okay, it's after the treatment.
Yes,
I
you
see.
can do some before, but you can't do any after.
And why is that?
Because the muscles are, at least for 24 hours, because with doing the muscle banding.
So no massage for 24 hours?
Mm-mm.
Okay.
You don't have a massage scheduled, do you?
No.
Okay.
No.
It's constricting those muscles, so it's pulling them up, and then if we massage, then it's pretty much going to undo like what
you just did.
Yeah. So this is the Rezenerate now. This
Okay.
is the device, what it looks like, the little channels on the head that are going to penetrate the serums into the skin. So we're just going to do small areas. I'm going to start on the forehead and work my way around.
Never had this done before, so it looks probably scarier than what it is.
Yes, it shouldn't hurt at all. So if it does, just
what's that?
This is the serum using hyaluronic super serum, which has a mixture between vitamin C and beta glucan, which helps strengthen the skin. And I have the Melanotech drops, has kojic acid, just more of an exfoliation to help with pigmentation in here. So I'm just gonna go back and forth, like,
Okay.
what all are you using for your skin regimen at home?
Cleansers first, then I do the beta gel and the vitamin C. Then I go ahead and I spritz with the
Urban Mineral.
Then after that I use, what is it? It's like an oil. It's like a
The CBD.
And then the last one is green.
The Biogen C?
Yes.
Yeah.
Then Biotin C.
Biogen C.
Biogen C.
Yeah, it's a firming.
That's really all I use, but I do use the image.
You use the SPF, right?
When I'm outside. You're like, your eyes just went like really wide. That was funny.
So do you think it hurts at all? It's comforting?
No, it's more like
It feels
like a little bit of a massage kind of thing. I don't know. I mean, I just feel it vibrating.
So what I think it kind of feels like is like a cat's tongue, like going across the skin.
Yes.
It's a little rough, but it doesn't hurt. It's just that weird, like. So this Rezenerate too, like if you have like any event, like the day of, it helps.
Lips too.
Yeah. Yeah.
What were you saying?
I was just gonna say, so like the day, it does help plump the lips. I mean, it's obviously like not long lasting, but like if you have an event that same day, like it definitely helps keep them, the appearance, they're definitely more plump and.
I don't really need too much more.
I know you
plumping.
don't, but because you have to think like lip filler is hyaluronic, and that's the serum's hyaluronic.
True.
So it's
good point. Yeah. Very true.
So if anyone would want just like an extra plump for like if they had a date or an event, this helps smooth out like fine lines too around the lips. If you do see cosmetic effect right away, that means that your skin is functioning, really good. So a lot of times too, athletes, people who are really active, they'll get it their first time. But most people, they don't, because their skin's not where it's supposed to be. That's why we have to do several of the enzyme 1 treatments before like going into the muscle banding. So because if you jump right into it, it's not going to be as effective if your skin's not functioning. I'm mixing up the enzyme 2 and 3 right now.
What does enzyme 2 and 3 do?
Well, the enzyme 2, the skin is getting oxygen through the plasmatic, oxygen to the muscle or to the tissue through the plasmatic effect. And it's also causing a passive muscle contraction, which then stimulates muscle regeneration and stimulates collagen production. So that's why, you know, the enzyme 1 we do several times before the enzyme 2 because we really want to get the skin up and moving so we get maximum collagen production. Alright. So there is a special way to apply the enzymes with where the muscles are. So we're not just like slopping it on.
So when I do mine at home, I'm supposed to do it a certain way?
It doesn't so much matter, but I would definitely do it like in an upward motion, like kind of how I
do that here.
Okay.
But
yeah, do it. I would go up on the neck, up.
So it's this way.
Yep.
And I'm supposed to be doing that once a week.
Once or twice a week.
At home?
Mm-hmm. Yeah, at least
twice a week?
I mean, at least once a week, especially in between treatments, because it's really going to help, you know. I mean, it is like the...
Well, it definitely helped while everybody was closed and being able to do that.
Once a week's perfectly fine.
When I say it feels like a cast, that I'm not kidding. It's like having a cast over your face. If anybody's interested or whoever's interested in getting light therapy done for themselves, you can see what the process is and just kind of check it out, and I'll give you my thoughts and feelings on it once it's done, because I've never had light therapy before. I've never had the Rezenerate done before either, and
yeah, you'll have to really compare to the difference that you see like before, because she's had enzyme treatments done plenty of times, but
yeah, I've never had the Rezenerate or the light therapy. So, but I'll get back, give you my thoughts and feelings on that as well, and yeah.
I'm going to put the enzyme 3 on over this.
And the enzyme 3 is
an intensifier for the enzyme 2. So this has cassia, which is cinnamon in it, so you can probably smell it.
I can smell the cinnamon, yeah.
Smells so
Guys, I'm gonna go ahead and head off now, let this mask harden, and I'll be back once it's ready for you to see what it looks like. Okay, so here's how hard it is. Good. Oh, I can talk, but barely. I can't move like here at all. Here. It's probably not good for me to do, is it? I was gonna break it.
Don't break it, don't pull it off.
Okay.
I mean,
I just wanted to show like how
really,
like flaky or...
You can see. I mean, even like down here, you can see it starting to break apart from how tight it was.
Okay, good point. All right. Yeah, so we're gonna go ahead and get this off.
She's probably ready.
I'm very ready.
I'm gonna put the goggles over her eyes to protect them. Like I was just telling her, this light is very bright at first. The closer to the skin, the better for this light. This is LED light therapy. This one is the Sloma brand in particular. And we're gonna put it on the wrinkles, the red, the blue, and the infrared. The blue light is the acne light. It helps kill bacteria. The red light is for wrinkles and anti-aging, and the infrared is for aches and pains and just healing the skin. Light is good for reducing inflammation. For healing the skin, it speeds healing of the body up by 300%. It helps build collagen, and these treatments are best for someone really wanting to see results with like building collagen and just healing the skin, reducing inflammation, reducing redness in the skin, seeing a difference in your fine lines, helping kill, for acne clients, helping kill that bacteria so the skin can heal and revise. Light therapy is so beneficial. Help reduce inflammation, helps build collagen, speeds up healing. You has muscle aches like on their back. You can put the light over the back too, and it really helps. And that there's a setting on here for aches and pains alone.
I think it would definitely be beneficial to get like one of those masks, like just for at home, getting like the stronger one, because this is stronger than the at home.
There's different types of LED. You can see on Amazon they have just like the ones that go over your face, like the face mask ones. There's these Luma ones, and then there's handheld ones. So then you can, heal the skin on the face and help with the aches and pains on the body.
And stretch marks.
Here's the afterglow. No makeup. This is directly from getting all of that done. Hopefully my skin should be good for a couple months. I'll see you guys later. Bye. I wanted to leave you with a few thoughts of my own in regards to all of the treatments that I had done. Getting dermablading done, just because I can tell a huge difference in makeup application. I'm not a big makeup person to begin with, but when my foundation goes on and it looks all crackly and it looks flaky and it's just not setting right, 9 times out of 10, it's because I need a dermablading treatment done. For the DMK, I've been getting that done for the last 1.5 years, so I absolutely love getting that done. I can't tell you the amount of change that I've seen in my skin compared to last year and today. So I love getting that done. If you can't afford to get the DMK treatment, I would recommend getting some sort of mini facial done and adding the dermablading to it, or whatever anti-aging skincare your specialist recommends getting done. 2 treatments that I really can't say much on would be the Rezenerate and the Light therapy. So I can't really speak on it. But the light therapy, my thoughts on that are, she said 12 treatments prior to seeing results and getting them done. Getting the light therapy done like 3 times a week, and they're $30 a pop. Yeah, I don't know about you guys, but I can't really go there financially. So my thought on that would be to get one of those light therapy masks that you can wear at home, and maybe do that daily, and then go into your specialist maybe once a month and then see what your results are. Sorry, I can't give you too much on the Rezenerate or the light therapy just yet. It's something that I need to test out for myself. Thank you for watching this video. I will see you guys in the next one. Bye-bye.